Welcome to the UNC Medical Center. My name is Josh. A central line is a soft, hollow tube that goes into a large vein that leads to your heart. Central lines are needed for the care and comfort of patients with ongoing healthcare needs. Basically, it allows your care provider to give medicines and to draw blood without inserting a needle into your vein every time. There are several different types of central lines. The first is called a port. A port is a central line that sits under your skin that usually goes on your chest. When you look, it will just appear to be a bump under your skin. When we are accessing your port, a needle will be pushed through the skin into the port. After your port has been accessed, the needle and the tubing will be covered with a clear dressing. When you no longer need medicine or blood drawn, your port will be de-accessed, meaning the tube and the needle will be removed. Your port will stay in place for as long as your care provider feels that it's necessary. When your care team decides that it's no longer needed, it can be removed with a small procedure. Be aware that some ports are single and some are double. A PICC is inserted in the arm, and the tubing can be seen outside the skin. It looks like an IV after it's placed. Your care provider will include the number of lines needed for your care, as few as 1 and as many as 3. You will keep the PICC for as long as you need care, and it may be used in clinics, hospitals, or even at home if you are specially trained by your care team. When the PICC is no longer needed, it can be removed by your trained care team. And finally, there are tunneled central lines. A tunneled central line is located on the chest and is placed directly in a vein. Unlike the port, you can see a thin tube or a catheter coming out of your skin. Similar to the PICC, your care provider will include the number of lines needed for your care, as few as 1 and as many as 3. You will keep the tunneled central line for as long as you need care, and it may be used in clinics, hospitals, or even at home if you are specially trained by your care team. When it is no longer needed, it can be removed by your trained care team. Using a central line will lead to a greater level of comfort for most patients, giving your care team greater access for ongoing care.